Welcome to The Peak, where becoming your best self is our goal. I'm Mike Mittman. On this week's episode, how a nonprofit is tackling substance abuse disorder, LGBTQ plus friendly places to visit, and an inside look at the impact St. Luke's Pediatric Center is making. All that and more coming up on The Peak. Families in our neighborhood suffer from substance abuse daily, and many don't know where to turn for help. Treatment Trends extends its community outreach to provide the necessary resources to those individuals in need. Let's take a look.
When you're using and you're on the streets, people walk past you. You don't have a lot of dignity, and people don't treat you with that. So having organizations and people who actually saw you as a person and just wanted to help you is what harm reduction means for me. Providing people with clean pairs of socks, haircuts, treating people with respect and with dignity. Anywhere somebody is at in their process is where we want to meet them. Treatment Trends is a bunch of different drug and alcohol facilities that help people in whatever stage of their process.
We oversee prevention, intervention services, and treatment for all of Lehigh County. So we work with people who have either no insurance, they're underinsured, may have Medicaid or private insurance. Navigating the drug and alcohol system is not very simple, so we try to work with everyone who comes through our doors to get them where they need to be.
Our hope is to build a sense of community for individuals at any level of their recovery process to come in and access services, to feel like they have a family, a safe place to go to, either in the daytime for services or in the evening time to have a safe, sober place to connect with other individuals. It's important to serve this population because they're stigmatized, they're ashamed to access services. 1 out of 4 families suffer from substance use disorder. That is my story. Like, I suffer from substance use disorder. I'm in recovery for 7 years, and it's something that I'm really passionate about, and it helps to connect to other people. It gives them a sense of hope that they can make it.
Substance abuse is not criminal in nature. More or less, a person is suffering through an issue, but we want to be able to help that person through it all. If we're able to connect somebody to treatment and help, and they're able to stay sober, indirectly that will reduce our crime rate. The foundational aspect is that communication piece, building relationships, making sure that the community that you work with knows that it's not an us versus them mentality. It's more of a collaboration.
Addiction is a disease that is no cure unless you are willing to put effort into your life and work on it. They help me, they understand me, they know that I'm struggling with my old past behaviors. They take their time to listen, to hear me out, to guide me through how to become a better person.
The substance abuse crisis in Allentown is not unique just to Allentown. We have, I would say, a nationwide issue that we're dealing with. Our department has made great strides to engage in some progressive steps to address this. One of them being the issuance of Narcan to our patrol officers, so that we're able to go out there and save a life.
Recovery can happen. It's happened for me. It's a wonderful thing.
We want to intertwine the entire community and let them see that people in recovery matter. We're not just defined by the drugs or the substance, and we can make a difference in our lives and other people's lives.
Don't be afraid to ask for help. We're here to help, and and it works. It works.
It's wonderful to see there is a safe place to turn to when we need it the most. Now let's check in with Holly as she visits LGBTQ plus friendly places in Lehigh Valley.
Here in Lehigh Valley, inclusion matters. Businesses from across the region are providing resources, recreation, and education to people from all walks of life. Today, we're focusing on the LGBTQ+ community, where Pride is celebrated throughout the year. The Bradbury Sullivan Community Center creates a vibrant LGBT community in Lehigh Valley through arts, health, and pride programs. Open weekdays to any member of the public, the staff at Bradbury Sullivan believes in access and education. It's a safe space where people can go where judgment is thrown out the window. Plus, events are popping up year-round. From opening doors for groups to gather to drag shows and health screenings, their mission is to make it so that everyone is welcome. Speaking of events, here's one to put on your itinerary. Wednesdays are for working it. And if you're in downtown Allentown, the first Wednesday of every month, you might have something to entertain your next happy hour. Prepare for a good time when you attend Work It Wednesdays. It's not only where you can grab a drink after work, but watch as the performers dazzle the audience. It's an event almost always accompanied by live music, happy hour specials, and pop-up shops. A different restaurant hosts the event each month in partnership with the Bradbury Sullivan LGBT Community Center. Those who come out say it's an occasion worth ditching work a little early for, or making sure your adventures include while visiting. Belonging and comfort is something we all strive for, no matter our background. Damachi Home in Bethlehem is bursting with pride for the LGBTQ+ community. When you walk into their Bethlehem storefront, you'll feel warm and welcome. It's where being uniquely you is essential. A wonderland for eclectically minded, environmentally motivated consumers and perceptive designers, the Damachi showrooms include almost every kind of home furnishings and gift ideas imaginable, including coffee mugs and other goods to show your pride. You'll find Damachi Home involved in many downtown initiatives supporting LGBTQ efforts. The staff supports the community by often giving a portion of proceeds to local organizations who provide resources for people of Lehigh Valley. Find just what you need at Damachi Home to elevate your living space and celebrate pride. And plan to attend our yearly Pride Fest too. Lehigh Valley is proud to support LGBTQ+ rights, relationships, and resources to make for a more inclusive and supportive community. I'm Holly Harrow with Discover Lehigh Valley, and that was a peek at the Valley.
Thanks, Holly. What a great insight on the exciting happenings in our region. Up next, we'll visit the Trolley Barn in Quakertown for a healthier way to enjoy your favorite dishes. Stay tuned. You're watching The Peak. St. Luke's partnered with the Trolley Barn to show that going out to eat can be both healthy and delicious. Take a look.
Hi, my name is Dr. Nugeta. I'm here at the Trolley Barn with Ziad, the owner of True Blue. We're here to put a healthier twist on a delicious recipe. What are we making today?
Today we're making the Greek salad.
Okay, that sounds delicious. Let's get started.
For this Greek salad, we'll need romaine lettuce, iceberg lettuce, shredded cabbage, tomatoes, cucumbers, feta cheese, and black olives.
That's the main foundation of the Greek salad. I'm gonna put some on my basket here, spread it around a little bit. Once we have the greens, we're gonna put the cucumbers in. So I'm gonna let you do the cucumbers next.
Love cucumbers.
And then we're gonna go over to the diced tomatoes. We're gonna put that in.
Next, we'll add the oils and spices.
Extra virgin olive oil. This is the lemon and garlic. Put that on top a little bit. And the key is not to overload. You want to balance the meal out. You don't want to put too much oil. This is the za'atar spice, which has sesame seed, thyme, oregano.
Let's see if I can get that shakedown. What makes this a Greek salad?
What makes it a Greek salad is by adding feta cheese and black olives.
Olives are very high in vitamin E and powerful antioxidants. For a healthier option, try without the feta cheese.
And then it would get a grape leaf. You could put the grape leaf right in the center if you'd like. I put it on your dish. You can put one on my dish if you like.
All right, that looks beautiful.
What we do is in the corners, we put our famous homemade falafel chips. Okay, so this is your plain Greek salad, but if you'd like, you can add a protein to it. You can add a fish. You can add a vegetarian dish to it. Some people love it with cauliflower. Some people love it with lamb. We're gonna add the protein, which is our #1 selling, the lamb, the shredded homemade lamb that we make.
That smells pretty good. I smell garlic. What else do you have marinating in there?
There's garlic in there, there's ginger, there's paprika, there's white pepper, and there's curry, and a couple little secrets in between.
It looks like it's browning nicely.
It's browning nicely, correct. You come back to your Greek salad, and then we're gonna grab our meats, and we're gonna take our homemade garlic sauce. It's called the lemonade, and just kind of like spread it around a little bit like that. And now you have a Greek salad with lamb.
Well, this looks delicious. I can't wait to try it. Thank you for sharing this healthier recipe with us.
Thank you. Thanks for coming out.
Salads never look so good. Thanks, True Blue. Now let's check in with Ashley. She is being joined by Dr. Janish Kothari from St. Luke's University Health Network as he shares his family's migration story and his love of medicine and fashion.
Welcome to Unscripted with Russo. I'm your host, Ashley Russo, and I am here with Janish Kothari. He is a doctor at St. Luke's University Health Network, and he is a cardiology fellow. Janish, thank you for being with us. You grew up in Jersey City, so not that far away, but a lot of times if you haven't crossed the Delaware, it seems like a totally different place. What were your first impressions of the Lehigh Valley, and what helped you really say, I'm going to do this fellowship at St. Luke's and live in the Allentown, Bethlehem area for a couple of years?
Coming here was obviously a significant change for me, and I didn't really know what to expect. I knew that when I was here for these 3 years, I'm here to just get an education, get my degree in cardiology, and see where the next opportunities would take me. But after like a year and a half that I've been here, I'm so pleasantly happy that I made this decision. I got a new perspective on life. I was trying to find the ideal location to live in that kind of still fit my lifestyle of wanting to live in an area that had something that was more lively and with activities and things like that. So that's when I came across the Allentown, Bethlehem area, and that's where I live now. And I've just been pleasantly surprised by so many things that I've been able to do here. I can only imagine what a life would be like here. You know, there's just so much to do, and it's so close to home, and you're still kind of far away where you still get that like suburban lifestyle and stuff. I didn't even know these are things I was passionate about until, me and my wife talked about it recently, like, we could see ourselves here.
Are there some favorite things you found? Is there a place you like to go, a restaurant, something that you and your wife do in your free time?
Music fest was a big thing, right? I was like, this is so fun, all the great music and food and just activities that we're able to do. Now that the PPL Center's been open, I've got to see a couple of the hockey games and just kind of seeing a lot of the activities at the Arts Walk. I live in Center Square, so they do a lot of resident activities and bar crawls and just outdoor music festivals and movie nights on a weekday.
I know, and how great is that downtown Allentown market?
Amazing. It's amazing. Me and my wife are such big foodies, coming from New York, New Jersey, we're like, food is everywhere. I am so surprised how good food is here. We went to Aman, which is kind of like on a Michelin-ish kind of restaurant. It's getting into Indian cuisine in Easton. Yeah. I got to meet the owner there, just the sweetest soul that you'll ever meet. Food is fantastic. We went to Oak across the street over there. We just love the ambiance, the drinks and cocktails and stuff like that. And just locally where I live now, I love a couple of the restaurants here. We love going to Zest, which is a great place. And one of our favorite spots is the Shelby.
Well, Dr. Janish Kothari, thank you so much for being a part of Unscripted. It's been awesome to get to know you better. We wish you so much luck on your journey. Thank you for your service to our community and being a part of the St. Luke's family in the Lehigh Valley. It's been great having you.
Thank you for having me and giving me the opportunity and platform to share my story.
Until next time, everyone, you're listening to Unscripted.
For the full interview, visit youtube.com/theptv. And don't forget to subscribe to Unscripted with Russo on Apple, Spotify, or wherever you get your podcasts.
During a routine eye exam, Nicholas and his mom, Carolyn, received some startling news. Let's see how St. Luke's Pediatrics quickly rose to the occasion by diagnosing and treating young Nicholas.
I noticed just around the summertime that he just looked thinner than usual. Coming out of water parks, I could see his shoulder blades a little bit, his spine. And I got a little bit worried. He already had a routine annual physical. So at that physical appointment, I brought to the doctor's attention just my concern about the weight. Blood work came back that his thyroid levels were really, really off. We drove to Allentown and met Dr. Abrams, and she was wonderful.
My job is to take care of children who have any sort of hormone disorder, and that's actually a really broad field. It includes children who are going through puberty too early or too late, and it includes children with thyroid conditions, high thyroid, low thyroid.
She was listening to me and my mom and everything that we had to say. She explained it very thoroughly. She drew us diagrams, what was happening that I could understand easily.
Nicholas has Graves' disease, which is an autoimmune disorder. That means his body's own immune system made an error.
You know, I've never had a phone call where I had an issue with my kids outside of regular routines. Of course, I was just nervous. I just prayed, watching him just be a normal boy outside. He had no idea.
His body's metabolism got revved up way too fast. It causes pretty significant problems, increases heart rate and blood pressure, and can cause nausea and vomiting and diarrhea and sweating and concentration issues, mood and memory issues.
It breaks down food fast. It gave me a swollen thyroid, and I think it worsened my eyesight. So we had to take blood work every 6 weeks to monitor my thyroid, see if the levels were going up or down. And then Dr. Abrams would study the results and get back to me and see if we had to do more blood work or if I was looking all right.
He did great. He went into remission, which can happen for some children with Graves' disease.
So I went into thyroid recession. In order to prevent it from coming back, I'm eating healthy and just maintaining a healthy lifestyle.
I'm very, very thankful to Dr. Abrams. She connects with your child and she will help your child feel like he or she is going to be okay. Dr. Abrams is the #1 player on the team and she will be there for you every step of the way. So I'm very happy with her, and I think that families going forward will be just as pleased.
Joining me today is Dr. Jennifer Janko, the chair of pediatrics for St. Luke's University Health Network. Dr. Janko, thank you so much for joining us.
Thank you so much for having me. I always love to talk pediatrics.
Well, the pediatrics department at St. Luke's is so critical and has grown so much. Tell me a little bit more about the services that you now offer for pediatrics.
So we've always had primary care, to take your child to the regular doctors, but sometimes children aren't healthy and they need to see other kinds of doctors like pediatric specialists. So we started with a few and we've added a few more. So we now offer services for things like pediatric endocrinology. So if your child has a hormone imbalance or diabetes, it's a big list.
It is a big list and it's grown so much. But before someone would go to a specialist for their child, tell me a little bit about the importance of general pediatric care from the time a child is born. What is entailed there, and why is it important to have a pediatrician really from day one?
So those primary care visits, those visits when you go to the doctor when your child isn't sick, that happen at scheduled times, they're more frequent as an infant and then become yearly starting at age 3, are really important so that your doctor can pick up on things that you might not pick up on. Or it's a great opportunity to connect with your doctor if there are some things you're seeing and you're not sure if it's important.
Why was it important to St. Luke's to continue to expand their pediatric offerings? We're only an hour from Philadelphia, an hour and a half from New York City, and yet now we've got specialists in almost every field right in our backyard for pediatrics. Why was that important to St. Luke's and to your department?
It's important for a couple of different reasons. I think first and foremost, when we're caring for a child, we're caring for all of that child. And so to be able to provide care for those additional types of medical needs was important, but we also provide care for really the whole family. To be able to provide that care right here, I think is just really part of our mission to provide excellent care locally for families.
Well, I can say as a parent, it's wonderful to know that those services are available should you need them. What can parents do to make sure that their child is getting the proper health care all the time throughout all the stages of their life? What are things that we should make sure we're following up on and make sure that we're on top of or looking out for?
Come prepared. Sometimes we'll ask, what questions do you have? And parents don't have any, and that's okay. But it's a good time to think in advance of that visit. What have you been observing in your child that you might want to delve into a little bit more at that visit? Whether that's a physical symptom, like is my child getting enough to eat or enough to sleep? Or whether that's more of a social, emotional type symptom, if your child seems a little anxious or withdrawn. Those are all good things to come prepared. And I'm fine with lists. Bring a little list over to us and we'll go through those things. When the doctor or your practitioner sends you home from that visit with a little homework or a to-do list, follow up on that. Sometimes there's blood tests to be done, not at every visit, but sometimes. Or they may ask you to come back in a couple months and recheck a weight or recheck a blood pressure. Make sure to follow up on the things that your practitioner is asking you to do.
I love that you say it's important to ask questions and come armed with a list, because I think some people do that and others feel uncomfortable that maybe they shouldn't be asking or they're bothering you. And I know that that's really your role and why you're there. So I think that's really important, and maybe part of how your team creates an environment that's opening and welcoming to families. How important is the team aspect, your practice extenders, the nurses, the techs, everyone helping out with pediatric care and with the families that you care for? How important is that team aspect?
It's incredibly important. Pediatrics is a team sport. Parents are captain of the team, and we all have an important role on that. So yes, within the office itself, there are advanced practitioners, there are nurses. Some of our offices will have mental health workers, social workers, some will have dietitians. At the hospital level, there's pharmacists. So there's all these extra people that are looking at every aspect of the care that that child is being provided to make sure it is age appropriate for your child.
Excellent. Well, Dr. Janko, thank you so much to you and the entire pediatric team at St. Luke's for your commitment to our community and to our kids. It's so great to see all these services right in our backyard at St. Luke's.
It's truly my pleasure.
Thanks for joining us. You're watching The Peak.
Routine checkups with a trusted pediatrician are important to track your child's development. I'm happy to hear that Nicholas is doing better and that the St. Luke's pediatric team took action right away. I'm Mike Nittman. Thanks for watching. To learn more about anything from today's show, go to our website at thepeaktv.com. And remember, every day is an opportunity to be your best self. This is The Peak. And this is The Bugs. At least I know the bugs like my cologne. Right? It's wonderful. Now get it. She is being joined by Dr.
Portions of this program were paid for by St. Luke's University Health Network. The Peak TV is a production of ASR Media. To watch more of The Peak, subscribe to our YouTube channel, like us on Facebook, and follow us on Instagram.
Like what you saw? Be sure to subscribe to our channel so you never miss another video.
To see more of The Peak TV, check out our website, subscribe to our YouTube channel, and catch us on WFMZ Channel 69.